Pregnancy and childbirth should be one of the most joyful times of a woman's life. You are carrying this child, you're excited to have this new baby, and the child's protected. And then labor comes. In many communities in developed countries, we have prenatal care. When we go into labor, we're birthing in a hospital or a good, clean healthcare setting. But for some women, that's not the case. Global Health Charities focused on global health, but we're also a charity. We have 4 major programs right now that we're working on. One of them is our signature program. It would be the Clean Birth Kit program, where we supply very basic items to women to provide for a clean birth, a healthy birth. That has been a wonderful program, and we're very excited to form new partnerships and really grow that program.
Having a clean birthing experience is critical to reduce infant and maternal infection and mortality. So the Clean Birth Kit program goal is to really provide clean supplies so that a rural situation where a mother can't get to a hospital and is birthing either at home or at a clinic or with a traditional birth attendant, they have access to really one of the critical items is a clean razor to cut the umbilical cord, and some simple things like string to tie the umbilical cord, gauze to clean the baby, and alcohol swabs. And so it's a very simple kit.
I mean, we are very grateful for the Global Health Charity for the birth kits. It's a wonderful package which has been donated to us, and especially very, very useful for our rural setup. We are going to hand it over to the medical superintendent there, and which will be utilized for all the deliveries, which come there. In the rural areas, the major cause of maternal mortality and infant mortality out there is, because you don't have the supplies or the kits for the deliveries as well. So, and sometimes there is a lot of sepsis and infections and all that. So this kit contains everything which is required for a safe delivery, and it would be very, very helpful to prevent mortality.
Let's try this first passage. I'm very passionate about Global Health Charities, and that as we go through life, I think we gain more understanding of who we are as humans and how we connect to other humans. It's an issue of wanting a better humanity overall and leaving the world a better place. I want to make life better for mothers who are doing the best they can and raising their children and delivering children in these rural places and these remote places.
We're at home in Michigan working with volunteers to assemble these kits, and people from all sorts of organizations like Ford Motor Company and Detroit Catholic Central and St. Catherine's, and schools and churches and hospitals, and this whole spectrum of organizations who have people who volunteer and who find meaning in this work and who donate items. We had the opportunity to deliver in person the clean birth kits that have been assembled in Detroit by a number of volunteers, and being able to deliver those personally was really important to us and gave us an opportunity to learn and speak directly to the traditional birth attendants who are using them, who haven't had birth kits in over 8 months, and shared with us some of the circumstances and situations that they get into with these births that are extremely difficult and really difficult to access areas. So knowing that these birth kits can help save a mom's life and save a baby's life is tremendous for us, and getting those directly into the hands of the TBAs was a really important part of our effort, and sort of closing the loop from seeing the volunteers back in Michigan who are putting these together and then being able to take those same bags and hand them over was just really meaningful.
No idea, this is like Christmas. This is Christmas and March. I have no idea.
Oh, wow. So happy.
It is. So sweet.
One of the interesting things about philanthropy or charity is that it doesn't matter where you're at. If you're in the States, you're in downtown Charleston, South Carolina, or you're here in Ho Chi Minh City, or you're up in Gurkha, Nepal, there's a common humanity that we all have. When someone hurts, we all feel it. And so we're excited about taking the stories and the outcomes that we've seen way out in the field, and then going back and completing that story with these individuals, just to let them know that while you had a good time and you felt like you did good, you not only felt like you did good, you really made a real difference to people that really needed it. That's what global philanthropy really is all about.